How many of you guys are suffering from pain in that thoracolumbar region? So right in the middle back, where it meets the low back at the bottom of the ribs. In that area, that's a common spot. Maybe you woke up one day and you had some pain there, and maybe it feels like muscle spasms, or it's tender, or it's difficult to lean back, or it's difficult to lean forwards. In a lot of cases, that could be just from oversensitivity or hypersensitivity of some of the spinal segments. It could be the adjacent muscle tissue just becoming inflamed or irritated, or just hypersensitive, an area basically the sensors that go to the brain are picking up perception of maybe something just doesn't like, and you're having this pain which causes spasms and all these other things. So what are some tips that you can do? Now, some of the things that you can do a lot of times, you apply moist heat. That works really well. You can use ice if you like. It just really depends up to you as to which one that you like better. That's always a debate, ice or heat. So I always leave that up to my patients, whichever one feels the best to them. And then we're going to go into a few active movements, kind of loading the tissue a little bit. And then we're also going to work on some stretches and a soft tissue technique using a tennis ball. So if you watch my videos, you know I'm a fan of using tennis balls for a lot of things for musculoskeletal health. It's cheap, it's easy, and it's simple. So we're going to go through those things right now. So our first technique is just going to be a knee to chest stretch. We're going to start with that. You're going to feel that in that low back or lumbar spine. You're just going to pull the knee up and try to hold that maybe around 30 seconds if you can. If you can't, 15 to 20 seconds is fine. And then I'm going to repeat that on the other side, just pulling my knee up, holding that position, and then coming back down. If you can't come all the way up with the knee, really bring it up, even if it's just a little bit, just start with a little bit, and then progressively, as you can tolerate, work on bringing the knee up farther and farther. And that's something that you would do just throughout the day. Now we're going to work on a stretch that combines rotation with a little bit of spinal flexion. This one works really well, especially if you can just lie static. You don't have to really do anything. You don't have to apply the stretch or anything using your upper extremities. You more or less can just lie still and let the stretch happen. So this is something, again, you're going to hold for about 30 seconds several times a day. The starting position for this stretch is going to be flat of your back. You're going to flex the hip to about 80 degrees or so, maybe 70 degrees. It doesn't have to come all the way to 90. You're going to bend the knee, and you're going to bring it across the other leg. You're going to try to keep your left shoulder flat on the floor or the bed, wherever you are, and then kind of rotate around a little bit and stay flat on the shoulders and bring this across. Now, if you do want to apply a little bit of overpressure or additional stretch, you can take your right hand and pull on the left outside the left knee. That's fine. You're going to feel that in your left hip. You should feel that in the low back. If that's too much of a stretch, back off. If that's too much of a stretch, drop the foot down closer to the other foot and just lie there nice and static. And that does really well at releasing or relaxing some of that tissue in that area. Now to work on stretching that middle back area, you're going to take a pillowcase. You can use a belt, a rope, strap, whatever you have. You're going to put it around a stable surface. Now this is a little low. You could use something higher. Some people have a post maybe on your front porch or something like that you can use. Just something stable. And what I'm going to do is kind of back off here and lean back. I'm feeling that stretch come through these lat muscles. My back, I can feel that stretch just kind of leaning in, holding on. I'm going to work on trying to hold that for about 30 seconds. Maybe initially, all that I can hold that for is 10 or 15 seconds, but just kind of do what you can with it. You're going to really stretch and hold that. And that's, again, another stretch that you perform several times a day. Just like the previous two stretches, you want to make sure and perform those just all throughout the day, whenever you have time and think about it. Just make sure you have a nice, stable surface when you perform this one. Now comes our tennis ball technique. So you're going to take a tennis ball, drop it down in a pillowcase. You can use a large sock or just bag, whatever you have that put that in. You're going to drop that over your shoulder. It's going to come back down your back wherever you're having that pain and discomfort. You feel that extra tension and just kind of lean into it. I'm going to lean in and hold that pressure. And that's something maybe I'll hold for a minute, 2 minutes if I can, if you feel like you can stand there. I'm going to hold that pressure. And now you also can do that lying on your back. So if you don't want to use a pillowcase, you don't want to stand, lie on your back and do that same technique. That also works well with those first two stretches I went over. You can apply this tennis ball in that area while you're going through the stretch, just to apply that extra force or pressure. And a lot of times that does really well at trying to help alleviate the spasms and or your pain. Next, we're going to work on a prone press up. That works well at trying to load those spinal segments, kind of in range loading and extension. This is something you perform, 10 to 15 repetitions several times a day throughout the day as you can tolerate. If you have a lot of pain and discomfort with this, don't go up as far, only go part of the way, and then you can come back down. Again, this is something you may have to just kind of work into and perform over time. So what you're going to do is you're going to go on your stomach. This can be on the floor, this can be on the bed. Go on your stomach, you're going to push up Create that sway or that curve in the low back, and then you're going to look all the way up at the ceiling, pushing up through your arms, and then come back down. You repeat that again, come all the way back up, straighten out the arms, and come back down. And that's something that I would hold for maybe 2 to 3 seconds at the top end of that with each repetition. You don't have to hold it, but you can hold it just to add a little bit of additional loading through those spinal segments. Now we're going to work on 2 loading strategies using a band I have fastened above the door. What you're going to do with this is work on keeping your arms out straight. I'm going to pull this down and back, keeping my elbows straight, squeezing my shoulder blades together. At the same time, I'm pulling back and I'm also kind of pushing downwards as well. Repeat that for 2 to 3 sets, 10 to 15 repetitions, 1 time a day. Then we're going to work on rotations. You're going to take that same band, you're going to come across the body, almost kind of pulling down, really focus on rotating the trunk. You're going to do that for 2 to 3 sets, 10 to 15 repetitions, and then you're also going to repeat that to the other side. Initially, use a band or resistance level that's pretty light. You're just kind of going through the movement, making sure that you're used to the movement and adjusted to the movement. You're going to perform that once a day, each one of those, and usually within the first 2 days or so, maybe 3, just depending on how you feel, you can start increasing that resistance level to return back to normal functioning. Thank you so much for watching. I hope this video helps with that lower thoracic, upper lumbar pain that you may be having.